Hi, my name is Alison Blevins, and I'm an OBGYN physician with the Women's Clinic of Johnson County, and I've been asked to answer a few questions regarding COVID-19 as it relates to our expectant moms for the KC Moms Collective in collaboration with Olathe Medical Center. So not only is COVID-19 affecting how we manage obstetrical patients in labor and delivery, but it's also affecting how we are running our clinics. And we have began seeing less number of people in clinics. We're reducing the visits to only those that are deemed essential. These are recommendations from the Society for Maternal Fetal Medicine and the American College of Obstetrics and Gynecologists. We are seeing obstetrical patients less often as long as they're low risk. We're utilizing telehealth as a great way to connect with our patients without them necessarily having to come into the office. We can address many problems via telehealth just by obtaining a good history and review of systems. We can then prescribe medication or determine if diagnostic tests are needed and when the appropriate time for that would be. We're also limiting the clinic to just patients only. No visitors are allowed, and this is a recommendation from the Society for Maternal Fetal Medicine. We do allow patients to utilize FaceTime or Skype or Duo so that the family members can still be a part of the appointment without necessarily physically being there. We screen patients for fever, COVID-19 symptoms, or potential exposure to COVID-19 to limit those from not coming into the clinic and potentially exposing other healthy patients. And all these recommendations are being implemented within all clinics around the city and nationwide. Each clinic probably has their own policy, but they are based on recommendations made by other medical bodies. Obviously, being diligent with social distancing, frequent hand washing, avoiding public places or large gatherings is ideal. Specifically as it relates to pregnancy, we would encourage all of our moms to socially isolate within the last 2 weeks prior to planned delivery, or at least starting at 37 weeks. This is a recommendation from the Society for Maternal Fetal Medicine as well as the American College of Obstetrics and Gynecologists. A lot of women, if they cannot work from home, are finding other measures to stay home, whether that's not working at all or making other arrangements. But the goal is to minimize any potential chance for exposure prior to the time of delivery. The first thing you'll notice is that there's hardly anyone there, and that's because we are only allowing one support person with each expectant mom, and that support person is the same support person the entire hospital stay. And then that is to prevent potential transmission to other patients as well as staff. You will be screened for fever or symptoms of COVID-19, and if there's concern that you may be positive, you and your support person will both be given a mask prior to entry into labor and delivery. This is something that has been implemented not only in the Kansas City area, but nationwide. All hospitals in the Kansas City area are allowing one support person into labor and delivery with you. Now, obviously, if that support person has known COVID-19, they will not be allowed onto the unit. But each hospital has its own policy, and I encourage you to contact your OBGYN or the hospital directly to determine what their policy is, what their screening procedures are, so that you're prepared. Again, we don't intentionally want to separate you from your loved ones, but we are trying to do what's best for you, your unborn child, the rest of the patients on that unit, and the staff that are taking care of them. So one thing that we are doing for our postpartum patients is trying to prepare them for an earlier hospital discharge. Obviously, we would not make anyone leave that wasn't ready, but for most women after a vaginal delivery, hospital discharge may occur after the second night, but we encourage patients to consider leaving after the first night as long as they feel safe going home at that time. For patients who have cesarean sections, we typically discharge after the third night, but we are encouraging patients to consider discharging after the first or second night, again, as long as they feel safe and stable. We're not going to make people leave if they're not ready, but the less time you spend in the hospital, the less time you have for potential exposure to COVID-19.